There are a lot of trends that go on in cosmetic surgery, and one of the trends that I'm seeing now is an up-tilted canthus where there is a elevation of sorts. I will always talk about that I hate changing canthal tilt. I don't like to change it. I think there is risk with doing so. I don't like to change the shape of the eye. I think there's problems with that. The canthus is an area that's sacrosanct to me. In other words, it's very holy, and I don't want to cause issues with it. This is the reason why when I do lower blepharoplasty, I don't make an external incision. I do a transconjunctival approach with no skin pinch. It's a light laser, it's a fat graft to help balance the hollowness of the eyelid, but I don't make an external skin muscle flap, because when you make an external cut, the scar is not the problem, although that is one thing that's good to avoid, that incision. It is the risk of having to retighten the canthus and elevate it. Not only do I believe these sort of mid-scalp elevation techniques that cause canthal tilt changes is unnatural, but long-term I think there's also issues and there's risk of functional deficits. For example, where I'm seeing issues of patients is they may be prolonged dry eye, over-tightening of the lid where there's functional disturbance to the lid, or a lid that's now been down-tilted that doesn't look quite right, and there can be prolonged eyelid swelling and issues with functional problems, closing the eye, dry eye, all of those issues. So in 20 years, I've never distorted the canthus even by a millimeter. I don't like that change. By the way, I didn't mention this. If you don't know what a canthus is, it is the joining of the upper and lower eyelids. I really think that if you change that tilt, change that angle, move it in or move it out, I think you create risk, create problems, both functional and cosmetic. It is not necessarily natural. Of course, you can show a few good examples where it looks okay, but there is overall a trend in this direction that I've seen that I think is unfavorable, and I'm opposed to it as a cosmetic facial plastic surgeon.